Hello. This is Ask Dr. Ben. I'm a coronavirologist, Dr. Ben Newman. I'm going to try to answer your questions. Next question is from Patty. How you doing? Yeah. And welcome back. Yeah, let's see. All right, question. Oh, and this is nice and short and sweet. Thank you. I don't know. Sometimes the questions need to be long, and that's okay. I accept that. But the short ones, yeah, I like them. I like them. With the Delta variant on the rise and schools not requiring masks, yeah, those two things seem contradictory, and they kind of are. Yeah, if you're into, I don't know, common sense or protecting kids or anything like that. So anyway, how do we protect the children under 12? Right, it's one of those two things: vaccinate or mask, or don't be there. But I mean, school is definitely important. I say that SARS coronavirus one got me where I am today, but school definitely played a part in it, and I had some good teachers along the way. So yeah, I guess that's a shout out to the Nile City school system, and some people in Toledo, and some people in Salford, and I don't know. I suppose I didn't stop learning once I got out of there. So yeah, bunch of people since then. Yeah. Anyway, let's see. As life is resuming and people are returning to work, can a vaccinated family expose or carry the virus and pass it on to them? So I know there are people worried. I know there are even people worried about, like, if I get the vaccine, would that be bad because then I might asymptomatically pass it on to somebody? That's kind of that's kind of backwards from the way that I think about it. Vaccinated people produce less virus inside them, according to the only study I've seen that looked at how much level you get in breakthrough cases versus unvaccinated cases. Yeah. And even there was a relatively small difference, and you didn't see it until quite a long time after the vaccinations were fully kicked in. So, yeah, but it's not. It's just sort of like where it's generally safe. I think what you see a lot is that in the parts of the world where I'm following the news, which is places I've lived generally, the UK, the US in particular, the metric seems to be that we look at how full the hospitals are, and when they get up to a certain level, that's where you'll then get some kind of push to take action. And before that, there's no push whatsoever. And in a lot of places, but not everywhere, thank goodness, you will get at the state level or possibly even national level, you'll get pushback, even to the point of saying that not that it's you don't have to take precautions, but forbidding taking precautions or requiring anybody to do that. And I think that's very counter to my understanding of what public health is supposed to do. And I think in general, those restrictions are not coming from the public health community. Yeah. Um, to analogize, because why not? Imagine you had a sewage leak in your basement, and it was just like an inch of foul, stinking sludge. But yeah, the if we were to treat that with COVID-19 logic, we'd say whatever, get a better pair of boots. Yeah, this is not. It's not really enough of a problem that it needs to be solved, and the only point at which we would consider trying to fix anything would be when your basement has literally filled up to the ceiling with foul, stinking sludge, and anything less than that is really something to monitor, but not a cause for concern. That's kind of the way we treat it. And yeah, I think I feel about as pro sewage in the basement as I do as I am pro waiting until the hospitals get full to do anything about this. So there you go. Yeah, the answer is right in your question. You know what you're doing as well as anybody else by the sound of it. It's either masks or vaccines. The vaccines aren't approved yet, and so it's got to be masks, or else, yeah, the general consensus just seems to be take that risk and roll those dice, sort of dare the virus. I bet you can't kill a kid. I bet you can't spread back to a family. And all that's kind of pointless. It's just like shouting at the sewage in your basement. It's not going to make it go down. It's sewage. It can't hear you. This is a virus. It can't hear you and doesn't care how we feel. So yeah, unfortunately, that is potentially a risky thing that is coming up. You've got case levels that are very high in some places and case levels that are high but still dramatically rising in other places. And this is just a kind of bad time, for anything. It's not particularly safe to be together. And even in the best of cases, with a vaccine, the individual is only going to be maybe 90% likely to be protected, which is still really good, and that's the giant personal benefit of the vaccine. But additional measures would be needed, and I don't know that those are being pursued at all. So I don't like it, but that's how it is, and I don't know how to tell you anything else. So I'm sorry. Maybe that's what I should say. I'm sorry. Yeah. Thank you very much. This was kind of a depressing one, but I don't know. When you see things that are fixable and it's more the will to fix them that is lacking than the tools, that sure gets me down sometimes. Anyway, I hope that somehow we'll get through this, and that somebody with the power to do so will see the light and try to do something about this rather than doing the opposite. So thanks very much. This has been Ask Dr. Ben.